Good evening, I'm Adrienne Arsenault. Andrew is away tonight with COVID cases spiking. Nova Scotia's locking down.
Public health is absolutely stretched to the max.
Also tonight, rare access at the front line.
We're putting the patient to sleep with medication and inserting the airway, which is very risky.
Inside an ICU with staff and patients. As provinces considered paid sick leave, why some employers are stepping up.
We don't understand why you wouldn't look after those people who you rely on to run your business day in, day out.
And seeking solutions in the soil.
Farmers are on the front lines of climate change. We see it every day.
Bringing old knowledge to the fight for the future. This is The National. For much of the pandemic, most Canadians have had good reason to look enviously at Nova Scotia. People there largely free of COVID, free to move about, but that's been changing recently. And today, that relatively good run came to a screeching halt. Starting last Wednesday, case rates climbed, and today Nova Scotia reported a record 96. So officials have declared a harsh circuit breaker lockdown, effective 8 a.m. Wednesday. Schools closed, non-essential retail and services frozen. Citizens urged, in no uncertain terms, to stay home. It's the province's response to a race between variants and vaccines, and the Premier himself says the variants are winning. Kayla Hounsell shows us what's at stake.
This is 5-year-old Romy, short for Rosemary. She has COVID-19, and so does her mom.
She keeps saying, I'm sick, but I'm not really sick.
So far, Romy doesn't have any symptoms, and her mom's are mild. Contact tracing has shown Romy likely picked up the virus at school.
COVID and its variants are on the move and spreading fast throughout the province. Faster than ever before in this province.
So today, Nova Scotia announced a province-wide shutdown. Thousands are lining up for tests as fear spreads along with the virus.
People with no symptoms are saying that they have symptoms to get a test in our online test booking. Please do not do that. It is causing delays for those who are critical that they get a test.
The case numbers may still seem small, but officials here have always said they act quickly because the healthcare system doesn't have the capacity to handle COVID the way bigger provinces can. That concern now already becoming a reality.
Public health is absolutely stretched to the max. Our testing capacity is stretched as far as we can go.
168 healthcare workers are now in isolation, either because they're sick and awaiting test results, or they've been at a potential exposure site. Strang says it is creating even more pressure on the system, so the province is asking for help.
We're deploying 60 Canadian Armed Forces members to testing centers in Nova Scotia. This will help stop the spread of the virus.
Stapleton and her daughter are trying their best to pass the time now that the difficult task of contact tracing is complete.
People are scared, and I felt like I had to apologize to people all day. It was just kind of emotionally draining.
Also draining, she and her daughter are isolating in one part of their apartment. Her husband, still testing negative, is trying his best to stay in another room, all while monitoring symptoms as a small province tries to fight back. Kayla Hounsell, CBC News, Halifax.
In Quebec, officials say a 54-year-old woman has died after developing a rare blood clot linked to the AstraZeneca vaccine.
It's very difficult to accept. At the same time, we knew we had experienced that elsewhere in the world where they said that there is a risk, 1 out of 100,000.
This is the first reported death in Canada related to the vaccine from the more than 1 million doses administered so far. Health officials are reminding people that it is still far less risky to get the vaccine than to risk getting COVID-19. Now, COVID cases in Manitoba are steadily climbing, and so new restrictions are on the way. But watching what's unfolding elsewhere in the country, some are concerned those restrictions won't be enough. Cameron McIntosh explains.
Effective midnight, life gets a little more restricted in Manitoba, but far from shut down. You won't be able to have friends over, but can still meet up on a patio for a drink. And kids will keep going to school. Despite concerns from many, Manitoba isn't going far enough.
In 9 days, 12 positive cases occurred.
Sarah Carroll's 9-year-old son is recovering from a case of COVID. She says he got at school.
definitely starting to see those early signs of transmission. So I would like, the province to recognize that and be a little more proactive.
While Manitoba's Premier and Chief Public Health Officer say the province is on the brink of a third wave spike, they insist a full lockdown can still be avoided.
So if we all do our part, this very well could be our last strict orders.
Vaccines are helping, but won't be enough. A group of doctors is calling for provinces to adopt more Nova Scotia-style lockdowns.
Those shutdowns become less frequent if you use that strategy, in my mind.
Quebec, finally seeing better numbers, is loosening up a little, reducing curfew hours, reopening most primary schools.
Well, I think it's related to these measures. I'm happy to see that we're doing better for this third wave.
They're prudent, I think, provided that we understand that it's still possible for things to change on a dime.
In Alberta, more big numbers, marking its second highest level of active cases since the pandemic began.
I'll look up.
Meanwhile, a little help for Ontario. Taking flight from St. John's this morning, a team of 9 Newfoundland and Labrador nurses and doctors, including the Premier's wife.
Well, when an opportunity comes to help your own country, I'll raise my hand for that.
More help could be on the way. Newfoundland and Labrador and Manitoba are 2 provinces that say they're looking at their resources and their numbers to see what help could come next. Cameron McIntosh, CBC News, Winnipeg.
So as you heard, 9 healthcare workers arrived in Ontario today from Newfoundland and Labrador. One of them is Dr. Alison Fury, an emergency physician at the Janeway Children's Hospital in St. John's, who's also been working at the COVID-19 assessment clinic, just happens to be Premier Andrew Fury's wife. So Dr. Fury joins me now from Toronto. Thank you. You have done this before, and I'm curious, what is it about this assignment that made you say yes so fast?
When I heard and saw my colleagues in Toronto and in Ontario struggling and overwhelmed during this COVID-19 crisis, it is in me to come to their aid. I've done this before in other parts of the world, and the opportunity to do it in my country is an opportunity I couldn't turn down.
It is pretty striking to see a military plane arrive and the back comes down and help is offloaded. But I also wonder what people are thinking when they see 9 people come off that plane. Are they wondering, what can 9 people do?
Well, 9 people can provide reprieve for 9 exhausted physicians and nurses and nurse practitioners. And people in Ontario, or physicians in Ontario and healthcare workers in Ontario, have not had an opportunity to take a breath between these waves. Big things can happen from small teams, and it may inspire other people to come and help. And I think that it's just the start, really.
What are you bracing for, Dr. Fury?
I'm bracing for some sadness, and helping people who are really sick.
All right, Dr. Alison Fury, thank you very much.
Thank you.
With so many outbreaks in workplaces, paid sick leave is a top public health issue. There is a federal pandemic program, but many find it hard to access and it takes time. As Katie Nicholson explains, Ontario is now taking fire for its attempt to fill the gap.
Radhika Gandhi's father, passionate about family and his work, which is where he likely contracted the COVID that ultimately killed him.
This could have been prevented if that person who maybe came to work sick just took a sick leave, but maybe those options weren't available to them at that time. And that's what's so heartbreaking.
Gandhi's workplace allowed just 2 paid sick days.
Nowhere near enough.
Last week, after months of pressure, this promise of a new sick leave program.
It will be the best program in North America.
But instead of a new program, the province is proposing piggybacking on an existing federal program. The finance minister sending this letter to his federal counterpart, offering a $500 top-up. It was quickly swatted down by the federal government.
Provinces need to look at the way to deliver sick leave directly through employers.
Ontario's Conservatives have had many chances to legislate paid sick leave. but they voted it down 25 times this year.
We want it to be permanent. It needs to be employer legislated. It needs to be accessible to all. It needs to be a minimum of 10 paid sick days, and it needs to happen urgently.
Across Canada, the majority of workers don't have paid sick leave. It's expensive and provinces resist making it law. One economist says that's one of the reasons the feds need to step up, at least temporarily.
The only way to make this happen is to recognize that this is an emergency situation, and therefore the federal government has a responsibility to step in.
That doesn't go far enough for Gandhi.
It's about time that the needs of our marginalized communities are addressed. You can't just provide a temporary solution for a permanent problem.
Any solution too late to help her father. Katie Nicholson, CBC News, Toronto.
Now, BC Premier John Horgan said paid sick leave was an issue for his government months ago, and he's promising action now.
I know that work was done through the summer to bring forward a provincial plan, and we are taking those off the shelf, and we're looking at how we can implement that in a seamless way without putting more burden on business at a time when business can least afford it.
But he provided no timeline. Last December, Horgan said his government was waiting to see how Ottawa addressed the gaps in its existing program. Despite all the talk about it, companies are required to provide maybe 1 or 2 paid sick days a year at most. But Diane Buckner shows us some are stepping up on their own, and not just out of the goodness of their hearts.
It's the kind of workplace where employees typically don't get paid if they're off sick, staffed by non-union, lower-wage, essential workers. But this manufacturer not only offers sick pay, he recently extended it.
Sometimes, employees have to isolate for up to 14 days.
With 500 employees, sick leave is an added cost, but it's helped the company stay open.
We've been able to stay operational throughout the whole pandemic. So the outcome is that it has actually paid off for us.
It's typically workers at the lower end of the wage scale that don't get paid sick leave. Some smaller companies say that's because they simply can't afford to pay it. Still, a number of companies you might not expect to even offer sick leave have enhanced their policies during the pandemic.
We changed our policy at Neil Brothers from 2 days to 5 paid sick days, and we go well beyond that.
Neil Brothers is known for its chips, snacks, and other food products, and doesn't dock anyone's pay if they have to stay home.
We don't understand why you wouldn't look after those people who you rely on to run your business day in, day out.
A study from the University of British Columbia concluded that 58% of Canadian workers do not get any kind of sick leave. But it's become clear that some workplaces are a major contributor to the spread of the virus.
Stay home when you're sick and lose pay, I just think it's not right.
This economist believes governments should only offer help to workers at companies that are in financial trouble.
Small businesses in the tourism sector, for example, or restaurants that are struggling versus, big grocery chains that are making quite healthy profits and seeing increased revenues.
Critics say that until more workers are paid for sick days, many will continue to work even when they aren't well, a risk some companies aren't willing to take. Diane Buckner, CBC News, Concord, Ontario.
So sick days are one tool in the fight to control this virus. Another, rapid tests. But as Rafi Boudjikanian shows us, there are tens of millions of them in this country not being used.
This is how easy they are to use, a student alone, unsupervised. And this is how hard some provinces say they've demanded them.
One that's been jumping up and down, screaming for the rapid tests more than I have.
Today, Ottawa says it has delivered tests, but that provinces and territories haven't deployed them, using just 1.7 million of nearly 42 million tests shipped across the country, about 4%.
Our job as a federal government is to be there with the supports that are needed, and that's what we have continued to do.
So why the low usage? In the past, some concerns have been raised about their accuracy. But today, BC's health minister said his province is focused on another kind of test.
Our goal is that on decisions on such as rapid testing,
that we are focusing right now on the 2.5 million PCR tests we've done in British Columbia.
So there's a little bit of tussle going on here in our federation. What really matters is, can we get our large businesses, our medium-sized businesses, and our small businesses to build this in?
For business advocates, getting tests in all sizes of workplaces is one of the best ways to use the tests.
You might say, okay, a hair salon can now reopen if it agrees to test its hair stylists 3 times a week.
Some infectious disease specialists say rapid tests should be used on one group in particular.
And in people who have symptoms, actually the pickup rate and the accuracy of the test to find people who are, truly positive is a lot better.
Some jurisdictions say they are trying to speed things along. Alberta, for instance, just got rid of a requirement that rapid tests need to be supervised by a healthcare provider. But the question across Canada is whether any changes will lead to more testing. Rafi Bujikanian, CBC News, Ottawa.
2 provinces are taking vaccines directly to workplaces in a bid to shut the virus down while keeping businesses open. Alberta launched its effort today to vaccinate workers at more than 130 meatpacking plants across the province, either through normal vaccine appointments or on-site clinics. In Ontario, vaccination clinics opened at Maple Lodge Farms. Maple Leaf Foods and Amazon will follow in the days to come. An estimated 10,000 undocumented migrants in British Columbia face a double pandemic threat: the risk of infection and the risk of deportation if they step forward to get vaccinated. So far, only 200 have braved the system to get their shots. Belle Puri looks at how fear is keeping thousands more in the shadows.
Cuerpo cortado, dolor de garganta, y me dio calentura.
Sore throat, fever, and body aches. When COVID hit this Mexican family of 4, the father says they wouldn't even go to a hospital.
Solo tomábamos Tylenol para la temperatura.
Tylenol and cough syrup were their only remedy.
En las tiendas.
The family's identity is being protected because they have no official immigration status in Canada. The husband and wife work in construction like many of the almost 10,000 undocumented foreigners in BC.
The outbreaks are happening.
It's estimated up to 3,000 cases of COVID have hit BC's hidden migrant community.
They are afraid that their information can be shared with other entities.
They want to be vaccinated against COVID, but they don't want to be deported. A visit to a clinic they fear will result in them being reported to immigration and possibly sent home. Advocates here want permission to help government set up no questions asked vaccine clinics.
People will trust us. Then if we organize specialized clinics, people will know us and they will come for the vaccine.
Byron Cruz says he has a waiting list of undocumented migrants who want the vaccine if they can get it in confidence, much like one refugee center is doing this week in Toronto. It should happen here, says this woman from Mexico living in the shadows with her husband and children for 6 years.
I know if by government they say and they respect our confidentiality, it's going to be amazing for this community.
The BC government has given assurances that information collected by public health officers at regular vaccine locations won't be shared with any other organizations. But as for specialty clinics, they'll only get the green light in conjunction with immigration authorities.
That's not enough for this family.
Y la verdad, sí. Sin pensarlo iría.
She says the vaccine is essential, but for now they remain undocumented and unvaccinated, willing to risk getting sick over getting deported. Belle Puri, CBC News, Vancouver.
A Mi'kmaq community in Quebec is coming to grips with a huge loss. An overnight fire has ravaged its only church. And that is the bell tower collapsing in flames. Video posted on social media shows St. Anne's totally engulfed. The cause is under investigation, but it's believed the fire started in the kitchen and spread from there. The church is more than a century old.
You would never expect something like this to happen. I've never seen something like this happen in my career.
And this is what he's talking about. A man is dead after an overhead sign fell on his car as he was driving near Hamilton, Ontario. Police say a construction excavator was also on the highway and hit the sign, causing the collapse. Several investigations are now underway. Well, domestic abuse isn't always physical. It can include coercive control, a pattern of isolating and dominating a partner. Today, a parliamentary report recommended a task force look at making it a new crime. One woman spoke with CBC News about the urgency of such a law. We are not identifying her because her case is still before the courts. Here's Tara Carmen.
The fact that one person can do that to another person is so wrong.
She thought when she left her marriage, the abuse would stop. Instead, it got worse. Her ex was never physically abusive, but he sent dozens of unwanted texts and emails. He even tracked her phone and showed up at their son's daycare, blocking her car in, ignoring her requests to stop contacting her.
I started having panic attacks. I was scared to, leave my house at some points because of that showing up, at different points. Like I was always worried of what's going to happen next.
She documented her attempts to get help, reaching out to more than 70 organizations and agencies, including police, who told her that his behavior didn't qualify as harassment.
If you have shared custody and he's allowed to be there, there's nothing we can do about it.
In Victoria, Sergeant Mike Darling sees this abusive behavior far too often.
Sometimes we see that this behavior has been going on in relationships for a long time before there's any violence.
It's called coercive control and can be a warning of violence to come. Sergeant Darling wants police to be able to intervene before it gets to that.
Control and isolation and domination of somebody, emotional and psychological abuse really isn't captured as its own offense right now.
Adding coercive control to the criminal code, a move initiated by Victoria Area MP Randall Garrison, would change that.
The current structure of the criminal code simply makes the police walk away even when they know that situations are potentially very dangerous.
Advocates warn the legislation won't fix everything, but say it identifies abuse that for too long has been out of sight and unnamed.
I wish one person would have said, hey man, what you're doing to her is wrong.
And for some women, it might mean help comes sooner. Tara Carmen, CBC News, Victoria.
Wrenching scenes inside hospitals continue to play out across the country.
I don't have any family. I don't have nobody without him.
We go inside a Montreal ICU where exhausted staff are bracing for even more. Plus, Americans can start thinking about a European summer vacation. But some advocates say that's unfair.
We should be doing it as a global community rather than pockets of privileged countries.
And swapping Swedish meatballs for loose Kinnikin, IKEA builds a unique showroom.
This is about what a homesteading looks like, especially a Mi'kmaq home that's intergenerational.
We're back in 2. As COVID-19 continues to push India's healthcare system to the brink, today Canada pledged to help by donating extra medical supplies and more.
We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally.
India is experiencing the worst outbreak in the world, with hundreds of thousands of new cases every day. Now, it wasn't long ago that the world's COVID hotspot was the United States. Now, the country with the most deaths is also the most vaccinated. 96 million people fully immunized, and mask rules eased today, too. But as Katie Simpson tells us, a significant roadblock now lies ahead.
Nearly everywhere you look in D.C., there's another sign of life returning to normal. And these outdoor spaces are expected to get even busier.
Generally, for vaccinated people, outdoor activities without a mask are safe.
The CDC says fully vaccinated people do not need to wear a mask outdoors as long as they are not in a large crowd. The unvaccinated are also safe without a mask when walking, running, or biking outdoors. They can also gather with small groups of vaccinated people outside mask-free. Indoor activities, including exercise classes and worship services, are also safe for the fully vaccinated as long as everyone is wearing a mask.
If you're vaccinated, you can do more things more safely, both outdoors as well as indoors.
About a third of the U.S. population is inoculated. But demand is slowing, and daily jab rates are dropping for a wide range of reasons.
It just felt like everywhere that I looked, I was seeing somebody with a new conspiracy theory or just a reason not to get the vaccine.
To fight resistance, doctors and pharmacists are being asked to talk with skeptical patients.
So we really need to meet people where they are and understand why they might be hesitant, and then give them the information that combats that hesitancy.
COVID remains a deeply polarizing issue. Just last night, a Fox News host urged his viewers to call police if they see a child wearing a mask outdoors.
What you're looking at is abuse. It's child abuse, and you are morally obligated to attempt to prevent it.
Despite these COVID tensions, public health leaders were very optimistic today. Cases are dropping. There are fewer hospitalizations and deaths. The numbers finally seem to be heading in the right direction. Katie Simpson, CBC News, Washington.
Next, the exhaustion, fear, and heartbreak inside a Canadian ICU as COVID rages.
I am nothing. I don't have any family. I don't have nobody without him.
We head inside Montreal's Jewish General Hospital, where teams are battling the disease and denial.
We people have COVID who don't believe in COVID. We have to try and persuade people that we really do know what we're talking about.
The changes staff are seeing this wave. Next. Welcome back. We've been hearing a lot about how overwhelmed hospitals are during this third wave of COVID-19 and the dire warnings about people getting so much sicker. Well, tonight we want to show you what that looks like right up close. Alison Northcott takes us inside a Montreal ICU.
The Jewish General Hospital was one of Montreal's first designated COVID-19 treatment centers as the virus began to take hold. Its ICU has now treated nearly 300 critically ill COVID patients.
We're worried about that younger patient population. We're worried about the longer length of stays. The reality of each wave is different.
Inside, 46-year-old Ramtin Saidi struggles to catch his breath enough to speak, but he tries.
La première jour que je suis arrivé ici, j'étais en train de mourir, vraiment. C'est la Covid, c'est vraiment incroyable, c'est vraiment difficile à dire.
He's emotional as he praises the doctors and nurses who have helped him since he was admitted to the hospital earlier this month, sick with the variant first detected in the UK. In the ICU, the COVID waves have blurred into a relentless grind.
We've been doing this consistently for over a year now, which is exhausting. We're all kind of tired of it. We're hoping that the third wave is the final wave. It all depends on how effectively we can get the vaccine into people.
Saidi's whole family was infected. His wife and 2 children are now recovered, and his doctor says his condition is improving.
So he's, came in and has responded quite nicely to our therapy. So what we saw was the amount of oxygen we needed to give him came down. And really the major thing is just looking at that trajectory.
But down the hall, it's a different story. Zanatul Ferdoush barely recognizes her husband of 29 years, Shamim Mohammed. The 62-year-old has been sick since March.
All the time he said, wear a mask, wear this and that. He was like extra conscious.
But he works in a restaurant kitchen, and despite his precautions, his wife thinks he caught the virus from a coworker during their lunch break. She and one of their children were also infected.
For me, it's a big tsunami. It's ruining my life. It's everything. I have nothing. I don't have any family. I don't have nobody without him. Just 2 years before.
She showed us this picture of her and Mohammed taken 2 years ago. She can't believe how much the virus has changed him.
Some people say COVID it doesn't exist. If it's not exist, then what is it? My question is, what is it? Please, 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 see him.
It's been a long haul for Mohammed's family. He's been in the ICU for more than a month, but Dr. Blair Schwartz urges Ferdoush to be patient.
This is going to take a very long time.
Because the trajectory of the virus can be so hard to predict.
The frustrating part is I don't know what's going to happen to his lungs. And so while we've seen lots of people spend weeks to months on a ventilator and ultimately go home and we get these amazing stories that they get better, sometimes that doesn't happen. And I think the frustrating part as a doc is I don't know. Families stepped out.
After more than a year of uncertainty, staff are bracing themselves in case this wave gets worse.
Do you have to brace yourself for that? Do you have the energy?
Do I have the energy? I'm trying to convince myself that I do have the energy, yes.
The stark reality of COVID-19 is the day-to-day here, so it's hard for staff when they encounter patients who don't even believe in the virus that's making them sick.
We have a few people who don't believe in COVID. We have people who have COVID who don't believe in COVID, which is awkward because it's hard to treat them at that point. We have to try and persuade people that we really do know what we're talking about. We've treated a lot of patients with this condition at this point.
Warshawski says ICU patients in the third wave are younger, in part because more older people are now protected by vaccines. But these patients stay longer and more of them need to be put on ventilators.
Take a nice big breath for me, okay? Big breath.
This is a procedure reserved for some of the sickest patients, with oxygen levels so low they need help from a machine to breathe.
The decision was made to intubate to try to save this patient.
That's respiratory therapist Krishni Francis at the head of the bed. The potential exposure to the virus in moments like this is what she and other healthcare workers grapple with daily.
We're putting the patient to sleep. with medication and inserting the airway, which is very risky.
This patient was stabilized, but could have weeks or even months ahead of him in the ICU.
Patient getting transferred to trauma elevators.
Saidi is doing well enough to leave the unit. A cleaning crew follows behind to wipe down any surface he might touch along the way. He's since been sent home. For Dr. Schwartz, seeing some patients improve and eventually get better has kept him going.
That's the hope that we keep. That's what keeps the team motivated, moralized, and it's what we're able to say to the family every day and say, listen, I know this is tough, and I know he looks sick, and I know he doesn't look anything like the man you knew and love, but we've gotten people like this back to that. And that's really, for me, what keeps it. And that's the story of COVID, is where this COVID coaster is going to go.
And as patients keep coming in, that unpredictable roller coaster continues.
And Alison Northcott joins us now from Montreal. So Alison, the exhaustion from everyone there, the patients, the staff, it just jumps out at you. But what else are they saying is tangibly different about this moment in the COVID crisis?
Well, the patients being treated in this ICU now are primarily in their 60s and 70s, though some are younger. And the way they're different from the patients in the first wave, who are mostly in their 80s and 90s, is that these patients tend to stay in the ICU for longer. And although their prognosis may be better, they tend to have a difficult and long recovery ahead of them. I spoke with the wife of Shamim Mohammed, who we saw in that story, and she says that her husband's condition has not really changed that much since I saw him in the ICU, and she remains very worried about him.
So hard. Alison Northcott in Montreal this evening. Thank you.
You're welcome.
Young farmers are seeing the effects of climate change and making some big changes to take it on.
We're dependent on Mother Nature, whether she be motherly or not so motherly.
Prairie farmers are going back to their roots to save the soil and the earth. Plus,
it's IKEA integrating into a space of Mi'kmaq.
The iconic furniture store showcases modern Mi'kmaq living. Stay with us. Welcome back. Modern agriculture produces more food than ever, but it all comes with a massive carbon footprint. The federal government's recent budget includes hundreds of millions in funding for new solutions. But as Bonnie Allen explained, some farmers have already joined the fight using an effective old-school method called regenerative agriculture.
This land has been farmed by the Israel family for 5 generations. Here, the fight against climate change begins with what's under the ground. And these guys are all part of the plan.
It's funny, you wouldn't think that the pigs would be combating it, but look at it. You see the manure on the floor, and that's going to be collected and reapplied to the fields as a natural fertilizer source.
5 years ago, Brett Israel joined the family business with his father Jamie and grandfather Carl. They switched over to organic, which means they don't use any chemicals to grow feed for their livestock. But Brett had another pressing concern.
Farmers are on the front lines of climate change. We see it every day. You know, we often joke and talk on the farm that we're dependent on Mother Nature, whether she be motherly or not so motherly.
There we go right there.
Yeah.
So the family also embraced a growing trend called regenerative agriculture.
We farm it and we still say wow.
Yeah.
That's pretty good.
It's essentially a set of farming practices that help rebuild the soil.
That's got good smell. Oh yeah. Look at the little guy.
Brett says earthworms and long root systems mean healthy soil.
This is the nitrogen fertilizer right here, all those nodules.
They planted alfalfa, oats, and winter wheat instead of leaving this land bare over the winter. It's a practice known as cover cropping. It helps the soil absorb carbon and reduces greenhouse gas emissions.
This cover crop might be not feeding my physical livestock or feeding people. It's feeding the biology below our ground right now.
For decades, farmers have been evolving the ways they care for the soil. Many have all but stopped tilling the land, especially on the prairies, offsetting some of their agricultural emissions. But experts say more is needed in the fight against climate change.
So we're just going to go up and check the system.
Here at the University of Guelph, agrometeorologist Claudia Wagner-Riddle has started to study how much carbon regenerative practices could actually store in the soil.
It's taking the carbon out of the atmosphere, but keeping it in compounds that are not easily accessible to be returned to the atmosphere again. That's the magic of the soil carbon sequestration. So if we look at this field, we could say this is a wasted opportunity because we could be growing crops at this time.
She's comparing data from this conventional field to data from a cover crop.
This field is a potential loss of carbon. It's not helping offset climate change to the same extent that this field that has growing crops would be able to.
Still, it can take years to see benefits from regenerative practices, and only if farmers commit long term.
To make a difference, this has to be implemented large scale across the country, basically.
While the science is still evolving and it's not mainstream,
there's about 250 ewes here.
70-year-old Blaine Jertis has been pitching the philosophy for decades.
I've been doing this 20 years now. To kind of step out and do something different gives a lot of people a bit of fear.
In southeastern Saskatchewan, Jertis frequently rotates livestock to graze in small pastures for short periods of time. He says it prevents soil erosion and encourages regrowth.
If we want to take carbon from up here and put it down, we need to keep leaves green as long as possible.
Jertis says adopting these new practices can take extra work, money, and education, but that it's worth it. He says his land absorbs more carbon than his neighbors, and that soil testing proves it.
On this farm, we are sequestering enough carbon to more than offset 400 Canadians' footprint.
How confident or exact are you in the measurement system?
Well, that's the great scientific debate.
So now Jertis is helping with a pilot project funded by the American food company General Mills. Jertis works with local farmers like Gary Richards, who's been improving his farm's ecosystem for years.
Good job.
General Mills is testing his soil and counting birds and insects on his land. The company is looking for ways to reduce its carbon footprint.
They're investing a lot of money on this farm and the other farms to collect data and to quantify this. So we'll put something else under there to stay green.
The push to quantify his impact on greenhouse gas emissions, now a marketing campaign too.
If we were carbon negative, then that oats that we grow here could be marketed as carbon negative. So there's the chemical, the physical, and the biological aspects of the soil.
Once the results are in, he hopes to also sell carbon offset credits and believes other farmers will buy into regenerative agriculture if it makes good business sense.
Incentivize good management practices to build soil, to build ecosystems, to sequester more carbon. Farmers will do it. You know, if they're going to get paid to do it.
While regenerative agriculture still has much to prove, Brett Israel is resolute.
You can have a global problem and make practical solutions right here on the family farm.
He believes that improving his soil to fight climate change is his way of making sure this farm will stay in the family for generations to come. Bonnie Allen, CBC News, Regina.
Americans are inching closer to European vacations, and the promise comes with prerequisites. Is Canada anywhere near? But first. Okay, so yes, that is an alligator chasing members of the Toronto FC soccer team off their practice field in Florida. The team apparently not quite sure what to make of the reptile at first, but it seems management has come around as they introduce the visitor as the newest member of the organization today. They know he can run, but can he kick? Welcome back. Well, we all dream of doing things in person again. Fully vaccinated Americans may be able to travel to Europe this summer. Magda Gebrselassie shows us how that could work and what Canadians can expect for themselves.
When the pandemic hit, Claire McCarville flew home to Winnipeg from Italy. Her work and travel plans ended.
I had lots of trips planned sort of to other parts of Italy that I really wanted to see, as well as other parts of Europe. So it was really disappointing.
Now the EU and the US are in talks to allow Americans to visit this summer. A COVID-19 passport called a digital green certificate could be required. It would say whether people have recovered from COVID-19, have tested negative, or are fully vaccinated, and list which vaccine. There's no sense of when Canadians might be allowed into Europe. But Prime Minister Justin Trudeau did say today vaccine certificates for international travel are to be expected.
How we actually roll that out in alignment with partners and allies around the world is something that we're working on right now to coordinate. I can assure you that our decisions will be based on science.
This law professor, Chidi Ogwamanam, says there are ethical concerns as well.
We should be doing it as a global community rather than pockets of privileged countries that make vaccines decide to determine who goes to where and who does not go to where.
At this point, travel shouldn't be the focus, he says. Aisha Patel, a travel consultant and a nurse, agrees.
I think until we get to that point where we have a reasonable amount of our population vaccinated, I think at that point we can start looking at the next step to allowing people to travel.
But right now, only about 2% of Canadians are fully vaccinated. And health officials say they're still grappling with many unknowns, including whether vaccinated people who are asymptomatic can spread the virus. Magda Gebrselassie, CBC News, Toronto.
A Nova Scotia IKEA is offering a glimpse into a modern Mi'kmaq home.
It's IKEA integrating into a space of Mi'kmaq.
The unique venture and the story behind it, next. IKEA has paired up with a Mi'kmaq educator for a unique collaboration, creating a showroom that captures a moment in the life of a modern Mi'kmaq family. So educator John R. Syllaboy collaborated with IKEA on the project and saw it as a great opportunity for community education. And this is our moment.
Early on, we had set out objectives and goals and expected outcomes for this so that we would avoid the exploitative nature of it and turn it into an educational opportunity and cultural sharing rather than becoming defensive and saying, oh, they just want to use our images and symbols to sell products. And that's not what this is about. This is about, understanding what a home setting looks like, especially a Mi'kmaq home that's intergenerational. We tried to do with the showroom is capture a moment of time in a family. We have art on the wall. We have baskets and moccasins and artifacts that I've collected over the years inside the cabinets, for example. We have real bread on the table, Luskinnigan, with my mother's recipe. A lot of people often misunderstand that we're building Mi'kmaq symbols and art into an IKEA space, when really it's the other way around. It's IKEA integrating into a space of Mi'kmaq.
And the staff said that they really just wanted to reflect the community around them. They knew it would be beautiful. They had no idea how emotional it would be when the customers and some of the staff walked by. And that is a national for April 27th. Good night.